Now we'll discuss the various types of dysarthrias. So as we're working through this section, I'm going to show you a variety of videos of clients, mostly clients that I've worked with in my career, who have motor speech disorders. And questions that I want you to consider as you're watching these would be, why do you think that the client might be having trouble with X? So the most prominent speech characteristic noted. So think about what could be the damage to the brain that they're experiencing. What speech subsystem do you think is most affected? So remembering that those are respiration, phonation, resonation or resonance, articulation, and prosody. Also consider what might be the impact of the motor speech disorder on that client's ability to participate in their regular life activities. How do you think the client's disorder might make it challenging for them to work, get together with friends, etc.? So thinking about that participation in life. And how might the client's family, employer, partner respond or have to adapt to the communication impairment? Alternatively, you can think about how would you have to adapt and what could you do to support that individual's communication? So there are a variety of types of dysarthria, but it is a speech disorder caused by disturbances in the central nervous system and the peripheral nervous system, which control our muscles for speech. And it affects the speed, the range of motion, the direction that we can move our muscles. It can impact the strength of the muscles, as well as the timing of motor movements. And all of those speech subsystems that we've already discussed can be affected. Either one or all or some of them will be affected in the different dysarthrias, depending upon where the damage is, how severe the damage is, the extent of the damage to the brain. And so speech can be impaired in a variety of ways, too many to list on this slide here. So just a few things that I put down here, which might be sort of hallmarks of dysarthria, would be slurred speech. The individual might talk too quickly or too slow, and too quickly comes from a lack of range of motion. So if the individual doesn't open their mouth very much when they're talking, they have the ability to talk really quickly. Or they may talk really slowly because they've got really weak muscles or really spastic muscles and they're really rigid and hard to move. You may also notice that the individual has really choppy speech. They might sound stuffed up, and what I mean by that is the resonance of the individual, so how much air and energy comes through our nasal passages, it may be different than what is normal or expected. And so the individual might sound stuffed up. And they may have impairment at the level of phonation. So their voice might be breathy, or it may be very harsh or tight sounding. So lots of ways that the speech can be impaired. Flaccid dysarthria is the first one that we will cover. It's caused by damage to the lower motor neuron. So we have cranial nerves that are really important for speech, and if they are impaired, then we can have damage causing flaccid dysarthria. Also the spinal nerves, which are really important for respiration, if they're impacted, we can have flaccid dysarthria. The main deficit of flaccid dysarthria really goes along with the name, which is flaccidity or hypotonia, which is weakness or that low muscle tone. And this can impact just one muscle group or several muscle groups. This dysarthria is the one that is the most distinct because you can have damage to just one level. So an individual could have damage just to the spinal nerves that lead to respiration, or they could just have damage to a cranial nerve that feeds into the tongue. So this dysarthria is very distinct. All the different types are very distinct from each other. And sometimes people break them down into different types of flaccid dysarthria, but we'll just leave it at flaccid dysarthria. So as I have lower on the screen there, you can see that it can manifest in any one or all of the speech subsystems. And I just provided some examples. So if respiration is impaired, maybe that individual will have reduced respiratory drive, causing them to have a very quiet voice. If phonation is impaired, so that's the level of the larynx, the voice, they could have reduced ability to bring their vocal folds together. Maybe they have weakness in one of their vocal folds, which could cause a breathy voice. Resonance could be impaired, causing weakness of that velopharynx, causing hypernasality, so it stays open, not closing off when we need the air to come out of our mouth. So if air is coming out of our nose, our nasal passages, then that causes that hypernasality. We could have impairment at the level of articulation. We could have weakness of any of the muscles that are required for speech, tongue, lips, jaw, face, causing the individual to have imprecise articulation. And prosody can also be impaired, which is, well, prosody is many things, but rate of speech is one of those things. And individuals with flaccid dysarthria often speak with a slow rate of speech. Something that's interesting to note is, flaccid dysarthria can be caused by many different things, many different etiologies. Bell's palsy is one of them. It is unilateral damage to the facial nerve, which is cranial nerve 7. There is no known cause, and sometimes people are born with it and then they recover from it. Other times people continue to have these issues with sort of weakness on one side of the face for the rest of their life. And one of those individuals is Sylvester Stallone, who was born with Bell's palsy. And he has a pretty distinct way of talking. It's kind of a slurred speech, and he's done fine for himself, that's for sure, but he definitely he's recognizable by his speech. Spastic dysarthria is caused by bilateral damage to the upper motor neuron. It also there is weakness within the system, even though it's called spastic dysarthria. There is weakness which is due to spasticity. Because the muscles are so tight and spastic and rigid, they have a hard time moving and they are weakened. So the spastic paralysis, it is a combination of weakness and a loss of inhibitory motor control. And remember, I talked earlier about the indirect activation pathway is really important for inhibiting those extra movements. So making sure we have good tone, good posture, and also inhibiting movements we don't want, like reflexes. So an individual may have hyperactive reflexes, their muscle tone will be increased, and they will be spastic and rigid, really tight. And again, this can manifest in any one or all of the speech subsystems. However, with spastic dysarthria, more commonly, because the damage is higher up within the brain, we will see damage to more areas of the speech system. And again, I just provided some examples here of the various speech subsystems and how they could be impacted with spastic dysarthria. So respiration, there could be weakness within the respiratory system that might cause short breath groups, which will impact how intelligible or how clear the individual's speech is. If a person has to take a breath every word or every syllable, that would be unusual. Typically, we take breaths after somewhere between 20 to 30 syllables. But sometimes people have very weak respiratory systems and need to take breaths more often. Phonation, again, that's the level of the larynx and the vocal folds. There could be spasticity within the vocal folds, so really tight. They come together and stay together really tight. So that could cause a really strangled voice quality. Resonance, again, we could have hypernasality. Even though we have spasticity, it's pulling the muscles into an open position, and that velopharynx can't close. Articulation, there could be rigidity within any of those muscles we use for articulation, causing really effortful speech. And you'll see this in the next slide with a client of mine. And again, prosody, these individuals often will speak with a slow rate because of how tight their muscles are. So I'm going to show you a video here of RD. He had a stroke at the age of 30, and here he's only about 2 years post-stroke. And he's going to be reading the Rainbow Passage, which is a very typical assessment tool that we use. It has all the sounds of the English language in it. And so it gives us an idea of how well the individual is doing. Throughout this video, you'll get a sense of how rigid and tight his musculature is. There are times when his muscles really go into a spastic movement, and he has a hard time relaxing it to continue his speech.
For the select six leaders, the
Okay, we'll stop there. I think that gives you a good sense of what spastic dysarthria can sound like. It's very tight, and you can see that in RD. There comes a point where his muscles of his mouth, especially his lips, become so tight and pull back that it really makes it hard for him to have clear, intelligible speech. He has a hard time making any sounds where you need to do lip protrusion, like or ooh or wuh. You also will have seen in this video clip that his respiratory system is impaired and his breath groups are about one syllable long. So he has to take a breath quite often, which again impacts the intelligibility of his speech. The third dysarthria we'll talk about is ataxic dysarthria, and this is caused by damage to the cerebellum or the cerebellar control circuitry. It results in incoordination and reduced muscle tone. The movements of these individuals are really jerky and lacking in smoothness. So oftentimes individuals with dysarthria, any type of dysarthria, will often say that people think that they're drunk. Ataxic dysarthria is the most common, or not common, it has the most parallel to drunken speech. It's really incoordinated. It has a variable rate of speech. It has variable articulation. So at times it can be clear, and then the individual might stumble over their sounds. So it's somewhat inconsistent. It is primarily a disturbance of articulation and prosody due to that incoordination and improper timing. So these individuals will have irregular articulation breakdowns, and they will have that really variable rate of speech. Unfortunately, I don't have a video of an individual with ataxic dysarthria. Hypokinetic dysarthria is due to hypokinesia or reduced movement. And these individuals often feel very stiff and they find it difficult to get their movements started. Hypokinetic movements are very slow and they have a very reduced range of motion because of that rigidity. The most common cause of hypokinesia and hypokinetic dysarthria is the disease Parkinson disease. So if you know anybody with Parkinson's disease or know anything about Parkinson's disease, you'll know that as they get later in their disease process, all of their movements become quite small. So walking is more of a shuffle. So their feet don't take nice large steps forward, but they shuffle, just very small movements, very reduced range of motion. The same thing happens to their speech. So they don't move their mouths as much. They don't move their respiratory system as much. So they have very reduced range of motion, even though when put into conscious thought, which we do in therapy, we can remind them to take big breaths and to make those big movements in order to have clear speech. But if left to their own and in their own spontaneous speech, they will have reduced range of motion, causing quiet voice, or I guess, yeah, they're quiet, and often quite monotone. There's not a lot of movement within the muscles of the level of the larynx and the vocal folds here, so to stretch and change the pitch. So they're often quite monotone. And they also have slurred speech or reduced intelligibility. And oftentimes too, they have very fast rate of speech because they don't move their mouth a lot. Because when you keep your mouth closed, you're able to talk really fast when you keep your mouth closed. But when you move your mouth a lot and you open your mouth, it is harder to go fast. So primarily hypokinetic dysarthria is an impairment of the level of phonation, articulation, and prosody. I'm going to show you 2 videos coming up here of an individual with Parkinson's disease, and you'll get to see the difference in what it looks like when an individual speaks spontaneously and when they're reminded to modify their speech and to take big breaths and to speak clearly, how they have the actual underlying ability to do it. But first, Parkinson's disease is a common idiopathic degenerative neurological disease. It affects about 2% of individuals over the age of 50. You can be diagnosed with early onset Parkinson's disease, but primarily it is diagnosed after the age of 50. It's caused by a degeneration of dopaminergic neurons, so a reduction in dopamine within the brain. And it prevents the basal ganglia to properly function. There are some genetic and environmental factors that seem to play a role in getting Parkinson's disease. And hypokinetic dysarthria is seen in about 90% of individuals with Parkinson's disease. So as I said, it's a degenerative disease. So over time, individuals will have more and more trouble with various motor aspects, and speech will be one of those. Many of you might be familiar with Michael J. Fox. He was diagnosed with early onset, so at the age of 29, in 1991. He actually didn't tell anybody until about 8 years later. He was able to hide a lot of the problems he was having. But if you listen to him speak now, you'll see a lot of the characteristics of hypokinetic dysarthria. Less so when he's acting, because he's actually using a lot of the tools he's used in speech therapy and acting school to make sure that he's being very clearly understood. So here's a client that I worked with, and in the spontaneous speech sample here, you'll get a sense of what his speech sounds like normally when he isn't really thinking about modifying it to increase his intelligibility. How does having this speech challenge, how does it impact your life?
Well, I can't sing to my wife.
Can't sing to her?
Oh, yeah.
Did you used to sing to her a lot?
Yeah, all the time.
Oh, that's nice.
Well, it's less in my contact with people.
Okay.
Already talking about things. So 2 guys are sitting and we're yapping. If you're in the you say, what do you say, it gets tired.
Right.
So when you're having fun, everybody says his own thing. So everybody can hear the whisper or something. But that's the problem. But it's not affecting my lifestyle. It's just that I feel that I'm not being heard properly and I can't speak properly. So I will have a problem.
Okay. So you feel that people can't hear you really well or understand you well, so it impacts sort of the quality of the conversation. Yes. And people are always asking you to repeat. Okay. All right. And you can't sing for your wife.
Yes. I only talk to her.
And what types of things did you used to sing to her?
Oh, romantic songs.
Oh, very nice.
In Hindi.
Okay. So you can see that, or you can hear, I guess, that he's got a quieter voice. He doesn't have a lot of movement in the respiratory system, so he's not taking in big breaths. He also has a pretty monotone voice, vocal quality. So there isn't a lot of movement within the muscles at the level of the larynx that would move those vocal folds around to change our pitch. And he doesn't move his mouth a lot. So his overall clarity or intelligibility of speech is impaired. So let's listen to him now when he's reading the grandfather passage, which is another typical reading passage that we do with our clients. It has all the sounds of the English language. And you'll note that I think at the beginning of the video, he even asks me, should I talk slowly and clearly? So he has been in speech therapy for quite some time and knows how to override the muscles, because he can make himself take bigger breaths, and he can make himself talk louder with more pitch variation, and he can make himself slow down and move his muscles more. So let's listen to a little bit of this here, just so you get an idea of what can be done with speech therapy.
Now, I want you to read this passage for me. In whatever way works.
It's about my grandfather. You wish to know all about my grandfather. Well, he's nearly 93 years old, yet he still thinks as swiftly as ever, like me. He dresses himself in an ancient black frock coat, usually minus 7 buttons. A long flowing beard clings to his chin, giving those who observe him a pronounced feeling of the utmost respect.
Please do.
Okay, we'll stop there. That just gives you a sense of his ability to modify his speech. Hyperkinetic dysarthria is actually, it's a really interesting one because the speech is actually normal in the individual. What makes it abnormal is the underlying involuntary movements that the individual is experiencing. So hyperkinetic dysarthria is caused by damage to the indirect pathways or structures of the basal ganglia, and these are important for helping to inhibit unwanted movements. The unwanted movements could be things such as tics or tremors or dystonia. And speech is often characterized by anything that the movement causes. So you could have really excessive pitch and loudness variation. If somebody has a big movement within their neck, they may have a big tremor or a big tic that causes their head to move to the side, causing a really weird pitch change. A lot of irregular articulation breakdowns because they may have some strange movements within their mouth, lots of variable rate. Inappropriate silences could also be there because somebody might have a movement which cuts off the flow of air. So the speech itself is normal. It's that the underlying movement disorder is causing abnormality within their speech. Mixed dysarthria would be when any two or more of these dysarthrias are present. And it can occur a lot in neurodegenerative diseases because over time, the neurodegenerative disease will eat away more and more areas of the central nervous system. And it can also happen, so here's an example, with ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. It develops over time into having damage both within the upper motor neuron and the lower motor neurons. So these individuals often have a spastic, flaccid, mixed dysarthria. And it does progress to a point where about 75% of individuals who have ALS will be unable to speak at the time of their death. Traumatic brain injury is another one that often causes mixed dysarthria because there's so much damage within the brain due to that axonal shearing. So the brain, when it hits, it goes forward, it hits the front of the skull, it will go back, it'll hit the back of the skull. So now we've got damage to the front and the back. And oftentimes there's twisting of the brain within the skull, causing damage to a lot of places. So oftentimes we have more than one type of dysarthria. I will play you this video clip of another client of mine. He actually had a stroke in a few different areas of his brain stem, as well as within his brain. And you'll hear, again, a different quality of speech that is caused by damage to multiple different areas. Again, he's going to read a portion of the grandfather passage. What I think is most prevalent is his his loudness and his pitch variation. It really is sort of all over the map. So let's take a listen.
Can you read that? Is the size of that okay?
Yeah.
Okay.
I have to read out of one eye.
Okay. Do you want me to hold it for you?
Yes. You was droll about my grandfather. Well, he is nearly 93 years old, yet he still thinks as swiftly as ever. He dresses himself in an ancient black frock coat. I have 2 frock coats.
Really?
Usually missing several buttons. Mine has all the buttons. A long beard clings to his chin, giving those who observe him a pronounced feeling of the utmost respect. When he speaks, his voice is just a bit cracked and quivers a bit. Twice. Notice that.
Okay, we'll stop there. So GM actually has a mixed spastic ataxic dysarthria. His brainstem stroke impaired the cerebellum, or the connection to the cerebellum, as well as the pyramidal tract, so part of the upper motor neuron. So he has a mixture. You can see there that he's got quite a bit of change within the level of phonation. So he's got a pretty harsh voice quality. He also has a variable rate. He has a lot of pitch variation. He has sort of a slurred speech quality, but he does have a lot of variability within his speech. So you can see from these various examples and the dysarthrias that I've reviewed that they're all very different, and it really depends upon the level of the brain and the amount of damage as to how it presents and the severity of it.